packaged food is also not recommended because there are presence of preservatives, lots of preservatives are there.
See what happens. The processed meat is actually harmful. It is carcinogenic. Processed meat means that ready to use. The sausage or whichever is, they were actually manufactured probably months back. They have high salt content, other preservatives. Those processed meats are carcinogenic, and you will be surprised to know that.
As already we have mentioned that colon cancer is the third most common cancer and is a fifth leading cause of cancer-related death. So now coming to our Kolkata data, so among all the respondents, we can say that only 9.3% recognize blood in stool as a colorectal cancer warning sign. So we have already mentioned that blood in stool is a warning sign for colorectal cancer. In spite of that, only 9.3% recognize blood in stool as a colorectal cancer warning sign. So because of that, there is delay. Now coming to consultation delay. So why that ma'am asked that why most of the time patient present in an advanced stage 4 disease, we know the survival rate reduced. If it is in stage 1, almost all around 90% patient cured. But most of the time due to this lack of awareness, patient present in a stage 3 or sometimes stage 4. So there was a consultation delay, 91.9%, so almost 92% delay doctor visit due to we can say there are some social stigma, there are some fear. So in spite of having these symptoms, there was delay in doctor visit. So
smoke or consume tobacco in any form, either it is smoking tobacco or smokeless tobacco. 60% said no, but 40% said yes. So it is the ratio of taking these tobacco related products is increasing. If the question asked that gastric problem, how many have the gastric problem, the acidity, indigestions? Now 53% of the population told yes, I am by myself a doctor, so I take the medicine by my own, and only 11% consult doctor for their symptoms. So, if as Dr. Sudip told that changing of bowel habit is very important and is an early sign. So, if the question asked that changing of bowel habit for a few weeks, constipation, loose moose, what do you usually do? Now, 55
for cancer. So this survey report that 44% responded that they reported tobacco consumption. So
Now many of us are constipating, right? So constipation itself that does not mean that you have colon cancer. There should be a recent change in bowel habit. So recent change means that earlier you have long-lasting constipation, but recently you are not passing stool for 2 days or 3 days. That there is a change in your bowel habit. So change is very important here. Not all people have similar fashion bowel habits. But earlier you used to have passed stool every day with some difficulty constipation, but now you are passing stool after every 3 days. And it is alternating with diarrhea. So there will be a 3 days of phase of constipation, and the 4th day will be some diarrhea. So this alternating constipation and diarrhea, that is important. Change in bowel habit. You always had a good bowel motion, good evacuation in the morning. Suddenly you are experiencing change in your bowel habit. This is new. And it should be for a considerable time persistent. But that does not mean that you are not passing stool for 2-3 days and you get panic that I have colon cancer. No, it should be for at least 2 to 3 weeks persisting symptoms. Third is vague abdominal pain, and any cancer related symptoms are usually persisting for 2 to 3 weeks and they are aggravating. All other symptoms, disease-related symptoms, they are fluctuate, but malignancy-related symptoms, they are always in downhill. They progress. They don't usually improve over time. So 82% of the responses, they did not know that blood in stool is actually early sign of colon cancer. They thought that it may be related to constipation.
Age group of distribution that the study has conducted around 10,000 of the responders. So we can see the 37% falling. Now, if we consider our state, Kolkata, that is total responder 466, as already mentioned. And Kolkata, it is around 4.7% responder contributions. Now, if we, in this study, there are some questions, set of questions that have been asked to the healthy volunteers or common people, that how they actually have the knowledge of colon cancer. So, first question is, do you exercise regularly, at least 3 times a week? And if you know, the WHO guideline now recommend it is 300 minutes at least walking, brisk walking, 300 minutes per week. So out of this, 54% they said no. So only 45% said yes. So you know that the patients are not getting, or common people are not getting exercise regularly. If the question asks like, how often do you eat outside or packaged food? 54% told that yes, few times a week. And 28%, almost 30%, they told due to the fast life or urbanization, they told almost daily. So you can see that processed fast food, how encouraging this common people, common young age group person to indulge in this daily, regular taking of outside packaged food or processed foods, because we don't have much time. We have the fast life with the urbanization, with the stress of our current working scenario. And avoidance of this kitchen stuff, they are now indulging in this. Now coming to this stress related, now more of the young patient we have seen nowadays, they are